Hello everyone, welcome back to the ObaNutrition channel. Today in this episode, I'll be sharing with you how you can be able to fix shortness of breath. First, we'll start by looking at the causes of it. Now, most of the time when it occurs, it's usually characterized by losing breath whenever you are talking to someone or even laughing. At other times, it might be whenever you are walking, moving upstairs, which is causing you now to opt for the lift because it's uncomfortable for you. Other times it could be you're doing some form of light exercise, probably you are riding a bicycle or even walking on the treadmill or running on the treadmill and even jogging. Normally this should not be happening. It is not There's no medical ground to prove that it is a normal condition for the body. It's abnormal, and this could be caused by several factors. The first cause is usually anemia. Now, in anemia, it means that you are either having low iron levels or even low hemoglobin levels, and at other times you are having deformed red blood cells or even red blood cells. When I speak of deformed red blood cells, I could use the example of sickle cell disease, where you find the red blood cells are kind of sickle cell shaped instead of being round shaped. In this case, it means that there's a reduced surface area in order to be able to trap hemoglobin. If there's low iron levels in the blood, it means that there's also no insufficient amount of iron that can be utilized to be able to manufacture hemoglobin as well. In other cases, it might be hemoglobin itself which is low, not due to iron deficiency, but it could be low due to an accident that happened and it caused hemorrhage. So for these cases, the best treatment would be to consume iron and vitamin C rich foods in order to boost your iron levels in the body and even hemoglobin levels. If there's chronically low levels of hemoglobin, another form of treatment would be to do blood transfusion with packed red blood cells or even do iron supplementation, either by using iron sucrose or even other forms of supplements. The second case by which shortness of breath could occur is because of respiratory illness. Especially during COVID, we saw this being a common occurrence. Other times, whenever you're having even TB, pneumonia, which are most related to the respiratory respiratory syndromes, it will also cause you to have this shortness of breath. Now, to be able to fix it or to be able to reduce the severity of it, the best treatment would be to consume calcium, vitamin D, magnesium, and even uh, omega-3 rich foods. Now, the best sources of these foods would be seafood, for example, fish and sardines or omena. Onions would also be a good source of this food, especially for calcium. You can also find some other source from sunlight where you might get the vitamin D. For magnesium specifically, it would require for you to consume a lot of green leafy vegetables because chlorophyll is made up from magnesium. So anything that is green in color would supply you with adequate magnesium levels. So green leafy vegetables and avocados would be your best sources. So if you can optimize on them, you can reduce the severity of the respiratory illness, and even the shortness of breath would start being reduced much and you'll have more relief. The other third cause of shortness of breath would be if you are overweight or obese. Now, if you want to know if you are overweight or obese, you must do a calculation of your BMI. This is where you take your height in kilograms divided by your height in meters squared. So if that number is above 25, it means that you are overweight, and if it's above that, it means that you are obese. Now, if you're having obesity or being overweight, the several ways that this could occur, the shortness of breath, is that one, if there's huge accumulation of weight around your chest area, it means that there will be reduced expansion volume for the heart whenever it's pumping blood. So for example, for activities that require a higher heart rate, for example, you are doing some form of jogging. So instead of doing 72 beats per minute, the heart rate would go probably to 90 beats per minute. So for this type of exercise, you'll find it that the heart is experiencing a problem in terms of being able to expand and contract efficiently because there's a lot of weight around your chest area. This will now result in you having shortness of breath whenever you're doing an intense exercise because the heart rate goes up and the heart is unable to relax and contract efficiently. The other the other way that obesity could cause this form of condition is if you're having a lot of weight around your neck area. This means you're having a fatty neck, or even you're having a double neck. So you might find some people, they have some form of double neck. You find a lot of fatty layer tissue around this place. One symptom of having a fatty neck is having sleep apnea or snoring every time at night. So it will start with a simple thing such as snoring, and whenever you're snoring, that's not a normal condition for it to occur. Snoring is a deficiency of oxygen that is happening. It means that your sleep cycle is continuously being interrupted in order for you to be able to breathe in oxygen. And this is occurring because the fatty tissue that you have accumulated around your neck is compressing the airway. When the airway is compressed, this means that there is no efficient transport of air around that point. This consensually means that whenever the heart is demanding for oxygen, especially at night whenever you are sleeping, so the heart is demanding for oxygen, but the lungs are unable to supply oxygenated blood efficiently. So there's a lot of pulmonary arterial pressure exerted on the lungs. This will now cause the right chamber of the heart to expand to a bigger size. Now, it's not supposed to be that way. The left chamber of the heart is the one that is supposed to be bigger, because it's the one that is pumping blood to the whole part of the whole system of the body. So if this occurs, it means that there will be poor pumping of blood to all other body parts, because the left side of the heart will be compressed by the right side, which is trying to trap oxygenated blood from the lungs. And so over time, you find that you're always losing breath, especially at night whenever you are sleeping. And so you have to use maybe a raised bed or even double pillows in order to have a sweet night sleep. Other times you'll find that whenever you're doing some form of exercise, or even whenever you are talking to someone, because there's an increased pressure in the lungs which is coming from the heart, and now the right side of the heart has expanded to a bigger volume than the left side, it will now cause that even when you're doing anything intense, the left side of the heart cannot supply oxygen to that particular place in order to continue without activity. The other form you'll find that obesity is now causing this problem is now the clogging of the blood vessels of the body. So your arteries are now getting clogged with fat. If this happens, it means the lumen of the arteries reduces significantly. This, if it happens over time also, you can find clots forming, because if there's increased pressure because of a narrow lumen of the arteries, it means we can chip off away some parts of the walls of the arteries because the size has reduced. And if there's continuous chipping, it will mean that clots start forming around those chipped areas. If these clots get to some capillary or small blood vessels, especially around the heart, it means there will also be poor supply of oxygenated blood to the body or to other tissues and organs of the body. If also this also occurs, there's a narrow lumen, it means also the quantity of blood that could be supplied. Imagine supplying something with a narrow pipe versus a bigger pipe. A bigger pipe can supply more fluid as compared to a narrower pipe. So if your lumen of the blood vessels is very narrow, it means also supply of blood is very inefficient. So you'll always find it difficult walking, talking to someone, or even digesting food. So you cannot even eat a lot of food, because those are activities that demand a lot of oxygen from the body. So the best treatment for this would be just to lose weight. Try to target to bring your weight down to the normal BMI, which is between 19 to 25. At that particular point, you'll find that all these symptoms will now resolve. The other cause of it, which is the last one, is having hyponatremia or low salt levels in the body. This could happen because you are consuming a low salt diet, or even you are losing excessive salt. So if you can lose excessive salt by experiencing frequent urination, especially if you are diabetic. You can also lose excess salt if you are sweating a lot and the amount of salt that you are returning in the diet doesn't meet the match of the amount you sweat. So if you're having excessive salt loss than the amount you're also consuming, it will result in that. So how does salt essentially cause you to lose breath? One, salt will cause an abnormal heart rhythm. If there's an abnormal heart rhythm, it means that even supply of blood whenever you are walking becomes problematic. The other way that salt can also cause this condition is that there will be reduced activity of the brain. So the brain is not able again to be able to coordinate your movements or even to coordinate balancing or such form of things because there's a low salt volume in your blood. So consequently, you now even start losing breath for activities that require a lot of balancing, a lot of brain coordination in order to be able to do such form of activities. So the best form of treatment for such a condition would just be consuming a glass of salted water every morning. For some people, it might look a bit awkward tasting such form of water, but that would be the best treatment for such a case. Just consume a glass of salted water every morning would be able to fix it and realize that your form of energy or even the ability to be able to do intensive tasks improve, especially if you do intensive workouts. So those are the ways that you can be able to fix shortness of breath, and I hope you have learned on the causes. Especially if you're overweight, lose that weight early because treating shortness of breath is very expensive. I can assure you that because I've worked with patients who have experienced this, and it's not something that spares their pocket, it's something that depletes their pocket. So try to fix it early in order to have sustained livelihoods. So thank you for watching this video and see you next time. Have a lovely day.